Hi, I am so glad that we are here together today. I want to introduce you to one of my friends here, Martha Kieffer. Martha and I have known each other, I would say, for 3 or 4 years through a mutual business that we have and also through a mutual business coach. So it's amazing how we've stayed in touch over the years. So I'm just so proud and grateful to have this opportunity to spend some time talking with her about heart health. So Martha is an RN and as a registered nurse for over 30 years. She's been experiencing cardiac care and education. And she also has that darn personal experience with devastating heart disease and how it can impact the family. And so having that circumstance, it caused her to review her lifestyle and make some needed changes in her own life. It allowed her to discontinue several prescription medications and look forward to many more years of good health. And what she likes to say is aging is inevitable. Growing old is a choice. I totally agree with that. Like to hear more about that too. She now combines personal and professional experience, heart health, tragedies, and triumphs to help others identify time bombs that may be lurking in their future and chart their course to avoid them. Her mission is to inspire people living happier, healthier, and live one heartbeat at a time, because healthy living is an adventure. So Martha, so glad to have you with us here today, and thank you for joining us.
Well, thank you for having me, Peggy. I've been looking forward to this for a long time. We've been trying to get together.
Yeah,
Yes.
absolutely.
Yes.
We are out busy helping others. So Martha,
Yes.
Would you mind diving in a little bit more about your personal experience with having these devastating cardiac issues?
Yes. Well, when my dad was in his 50s, he was very active. He was the pillar of a community. He led one of the top agencies in his insurance company in the whole country. He made speeches from San Francisco to New York, and from Texas to Wisconsin, and everywhere in between. He was a professional speech maker too. And at the age of 53, he underwent open heart surgery, which this was back in the early 70s. So it was still fairly new. And he just never really woke up after that. He had a massive stroke, and he went from making speeches across the country to not being able to speak at all, and having his right side paralyzed. So our lives were changed forever. And through a lot of determination and speech therapy and therapies of different kinds, he was able to speak again. Nothing like he did before. And he was even able to drive a car for short distances. But they had a place out in Arizona, and he would drive his golf cart around. So that was always fun for him. I was glad he could do that. And then my mother had dementia. So both of my parents spent over a decade in nursing homes. And that's why it's been my mission to keep people out of hospitals, doctors' offices, and nursing homes in any way that I can. Now, I myself, in my 40s, I started having the blood pressure problems, was on 2 different blood pressure medications and a cholesterol medication. And I remember one Christmas down at my parents', I said, well, I started on a statin, and my brother said, well, that makes everybody at the table. My whole family we were all on statins and blood pressure medications and things like that. So I saw myself, those time bombs were ticking in my future louder and louder as the older that I got. So I decided to do something about it. And I found a nutritional product actually that helped me really make some changes. That was kind of the impetus of making those changes in my life and starting my way on a healthier lifestyle. And after several years, I was able to come off 2 different blood pressure medications and my cholesterol medication and my statin. So, yeah, it's really my passion. And I spent over 7 years in a cardiac intensive care unit as a nurse. And then I did get into the education field, which is really my passion, and taught cholesterol management and stress management, and ran a blood pressure clinic, and even taught smoking cessation for years. Um, so I've kind of done it all in the cardiac education field, I feel. And that's why I have decided to help other people avoid those time bombs that may be ticking in their future too. But I want to, that's why my company is called the Healthy Living Adventure, because it's an adventure. It's like, find out, see if this works for you, test it out, take a test drive and see if it works, because it's not a hassle, it's not a burden, it's not a, oh, do I got to do this or do that. It's an adventure. And that's what I want to help people find their way through that adventure.
Wow. Wow.
Yeah. Yeah.
Martha, I must say that you have been through a lot. So I want to ask you, let's replay that scene when you're sitting at the dinner table. You're sitting at the table with your brother, and if I'm catching the timeline correctly, both your parents were still there, correct?
That's correct.
So you're sitting at the dinner table announcing that you're now on blood pressure medications and cholesterol meds and stuff, and your brother chimes in, that's all of us. What went through your head at that time when you looked around and said, we're 100% medicated family on diseases that are possibly preventable? So kind of tell me what your thoughts were at the table that day.
Well, at that point in my life, I thought, well, it's just kind of inevitable. It's in our genes. It's just something that I will have to deal with. And that was before I found out that our DNA is not our destiny, that we have control over our lifestyle factors. And as you may know, you probably do, that there's a whole field of biology now called epigenetics, which epi is above or before, and that our genes are not. We can very basically describe turns genes on and off according to our lifestyle, according to the things that we put in our mouth, the things that we do every day, the amount of sleep that we get, even the things that we think can affect the very cell walls. Our thoughts can affect what our cells let in or out on a day-to-day basis. When I ran across that research, it was like my mind was blown. That even our thoughts that we think can affect at the cellular level what goes on in our bodies. That's why people who have that positive mental outlook tend to live longer, have fewer heart attacks and fewer chronic diseases. It's not always easy, how well I know, but it's definitely a goal for which we can shoot. So, and it's perception too. Do you choose to look? Gratitude is one of my basic beliefs, values, core values. So every Monday, well, not every Monday, but most Mondays, I'm like, thank you for my washing machine. Thank you that I don't have to go to the creek and beat my clothes every week. Thank you that I have clothes to wear. Thank you that, because yeah, so I try to turn things around if I find myself going down that path, to turn myself around and be grateful, because there's so much to be grateful for.
Oh, absolutely. Totally agree. I like your statement that DNA is not your destiny. And, I totally understand that, and know that so many people think when they're handed that diagnosis that that's their permanent prognosis. And it's so different that Western medicine doesn't encourage alternatives. So how long after you were sitting at that table and going, well, this is my life, this is my destiny, did you kind of get that wake-up call? And what was it? Tell me a little bit more on how that changed. I mean, you mentioned the epigenetics, that you were introduced to that, but it's a relatively new field. So I don't know if that was something that impacted your decision to go, you know what, I have a choice and how to do that. So how long after were you had this big revelation?
Well, probably a couple of years. I was doing my heart health consults at the hospital. And a patient came in and said, oh, my cholesterol's down. It must be this product that she was taking. And I had never heard of it. And once I explored it, I started with a product and started being around people who were healthier and who understood the nuances of lifestyle. They don't teach that in nursing school. They're teaching it probably more nowadays, but for sure, they say we've got a healthcare system in our country, but it's really more of a disease system. They don't really teach how to be healthy. They find the disease and fix it somehow. I always say in the medical profession, if you can't cut it, burn it, or poison it, it's not worth fixing. So when you start talking about prevention, their eyes kind of glass over and go, well, I don't have a pill for that. So, but I started getting around these people who were healthier, and I started doing healthier things. I gave up my diet pop, which I was clearly addicted to, and made some other lifestyle changes. High fructose corn syrup and trans fats and all those things are no longer a part of my life.
Oh,
And,
wow. Some significant changes. That's amazing. That's amazing. Yeah.
Yes.
So how do you now transfer your experience into the work that you're doing now? So tell me a little bit more about what you do now.
Okay. I do have a Facebook page, and it is called The Healthy Living Adventure. And I do videos every week. I know this week I started my cholesterol. I'm doing a series on cholesterol. And I have done series on blood pressure and diet and exercise and things like that. So I cover all that on my webpage. I also do a free consultation, a risk assessment, a discovery session to see what time bombs might be in your future, and to help you begin to chart that course around those time bombs. And then I also offer a 4-week class to talk about the heart healthy lifestyle. And then of course, individual counseling too. So that's what I do, is help people just see what's going on in their life and make some suggestions. I can't change anybody. We all have to be willing to change ourselves. And I can do that, help people do that, help people discover the ways that they can change, make those healthy changes, and possibly get off their medications too. But it took years now. It took me 4 or 5 years before I was able to get off the medications, because it's not like taking a drug, it's a lifestyle. It's a lifestyle. And that's what I encourage people to do, is to make those lifestyle changes. And so many times, a lot of people know what to do. It's just the accountability. And sometimes I need accountability too. I hire a fitness coach or something like that, just for that accountability. It's like, because if you're going to be talking to somebody and they're going to be asking you, oh, did you do this? No, I didn't do that. All right. It's just that extra little oomph to get you over that hump until it does become a lifestyle. So.
Yeah. Okay. Nice. So what are the signs and symptoms of that ticking time bomb that you talk about? What are some of those signs and symptoms? When you sit down to talk to somebody, what kind of questions are you asking them?
Okay, yes. Well, about their family history, there are certain risk factors. Well,
about some specific kind of things that you're looking for, something that you go, what, this is your fuse is this short, so what are those key indicators that you really are looking for when you want to be able to diffuse that ticking time bomb? So what are some of those key fuses?
Sure. Yes. Well, I say, they say medicine is a science. But there's nothing that I know of where every time A happens, B happens, right? Because we all know Great Aunt Gertie, who smoked 4 packs of cigarettes a day and lived to be 110 or something like that. But forever Great Aunt Gertie, we know the Toms and the Dicks and the Marys who smoke, and they have heart attacks, they have lung cancer, emphysema. So I like to liken health to playing Russian roulette, because we all know we've got a bullet. We all know we're going to die someday, but how many other bullets do you want to put in that chamber? So that's what I help people do, identify their bullets and see if we can't pull them out of their chamber. You know, if you want to smoke, add a couple more bullets. If you want to get your lunch through a window every day, add another bullet. So the bullets that I look for, there are things that you can't change. It's your sex. It's your family history, it's your age. All of those things you can't change. So you just have to deal with them and try to turn off as much as you can of those bullets. But then other things like your blood pressure, your weight, smoking is big. Diabetes is a huge risk factor, as is blood pressure. The American Heart Association estimates that over half of the people in America today have high blood pressure, and many of them aren't doing anything about it. What else are some risk factors? Of course, your cholesterol, and there's I don't know if you want to get into all that, the different types of cholesterol, the LDL and HDL and triglycerides and all of that. But all of those things give us a picture. And then diet too. Oh my goodness. Are you eating fried foods? Are you eating lots of sweets? Are you drinking pop? All those sugary drinks. Now they're starting to come out with research that's saying that sugar intake is even a greater risk for heart disease than the fats. And I do a class on fats, the good, the bad, and the ugly, because there are some fats that are good for you, but again, in limited amounts. So diet, exercise, sedentary lifestyle. They have even shown, well, the American Heart Association recommends 150 minutes of moderate exercise every week, or 75 minutes of intense exercise every week. So that works out to be about 30 minutes, 5 days a week. If you can do that, that's really good for your heart. But they have done research that has shown that even if you get your 30 minutes every day, if you sit all day, it negates some of that positive effect. So I've got my Fitbit will buzz me if I haven't been up walking around in an hour. So get up and move. I spend a lot of time on my computer. I put it up, raise it up and stand up and work on my computer for a while and walk in place, even get my steps in. So
yeah. So so it sounds like there's 2 parts to this. There's some of the things that we cannot change, like you said, age and your sex and your gender.
Correct.
But there's some things that we can definitely change, modify, improve. So pointing out and having that discussion, because I think sometimes, I remember when my mom was on in years and she had multiple doctors, and Dr. A didn't know what B was doing or C was doing. It was actually her pharmacist who was able to go, you know what A's prescribed is not going to work with C. And so, what you could be doing is bringing all that information together and then evaluating it and go, what, these are multiple risk factors that are adding up, and the consequences of that could be dire, so that you're bringing that together and having that discussion. Because I know when I worked as a personal trainer as well, that, a doctor may look at a number and just pass it over or say it's a little bit elevated, not really have any sort of discussion or take preventive sort of action. So it sounds like that you can do that, is that prevention is a big piece for you. So thanks so much for sharing about that. So
can I just interject? You do bring up a good point, that if you don't want to work with someone, with a health coach, that having one pharmacy, that's key. I do a whole lecture on that too, because your pharmacist will see all of those things. If you go to, particularly if you have multiple doctors all prescribing, make sure you have the same pharmacy, because they can catch that. That's an excellent point that you brought up.
Yeah, absolutely. Absolutely. So, so if you think someone's having a heart attack, let's hone in just a little bit on this. I mean, I have heard that there's a big difference in the signs and symptoms in a man having a heart attack and a woman. And that we have seen women who have been having one, but they pass them off as other symptoms of indigestion or stress, or the kids are bugging them or something like that. So, you know, as a woman, what symptoms might we be aware of? And I don't want to, you know, have everybody think when they're having a stressful day that they're having a heart attack, but I also want them to be aware, because that's my understanding, is that those symptoms are different for a woman than versus a man.
They definitely can be. Some of them will be similar, but they definitely can be different, because women tend to have the blockages in the smaller blood vessels. So they present with different symptoms, like you said. I can remember back in the dark ages, whenever I was first in nursing, and people would come in with the strange symptoms, and we'd go, well, that can't be a heart attack, because they're not having the classic is the elephant on the chest, the crushing pain. And they weren't having that, so it can't be a heart attack. But now we have found that, particularly with women, they can, and anybody can have pain in the jaw, pain in the neck, pain in the back, even pain going down one arm. Typically it's the left arm, but it can be the right arm. So any of those things, it could be feeling like indigestion. That could be a symptom too, particularly for women. You're right. But also the cold, clammy skin. If you're sweating and you have not been running around, or you're not really hot, that's a sign, good symptom of a heart attack. Shortness of breath. You just can't get your breath in. It just won't come in. That's another sign. Fatigue, particularly for women. And it could be days leading up to the actual event, the actual heart attack. Women have expressed, I'm just so tired, just so tired. And then one day they start exhibiting all the other symptoms too. And let's see, sometimes you just feel it, that something's not right. So in fact, when I was working in intensive care, I hated when my patients said, I feel funny.
Oh.
Yeah, the next
The
minute
alarm bells went off in your head, huh?
Yeah, absolutely. You know, it's like, no, tell me you have chest pain, tell me you have shortness of breath, don't tell me I feel funny. Because then their heart would go into that irregular rhythm, that not life-sustaining rhythm. And yeah, but that could be a symptom too. Dizziness could be a symptom. Lightheadedness could be a symptom of having a heart attack. So if you are having multiple symptoms like that, and even if you don't know, if you just kind of, well, I don't know, or whatever, call 911. Please call 911. I have a friend who was having a heart attack and had his friend drive him to the hospital, and he died on the way to the hospital. You know, your mode of transportation to the hospital could determine life or death for you. Because I always wonder, if he had been in an ambulance with the EMTs and paramedics there with him, could they not have saved his life? It's possible. It's possible. So call 911 if you're having these symptoms. Chew an aspirin. I read a study where they had one group swallow the aspirin, one group chew the aspirin, and then the third group took Alka-Seltzer, which I didn't even realize had aspirin in it, but it does. And what aspirin will do is it will keep the blood from clotting. So it'll keep that blood clot from getting any bigger. But anyway, the people who chewed the aspirin and then swallowed it had those effects of the blood not clotting as fast, more quickly. Then they were the fastest to see results. Then the Alka-Seltzer was the second group, and then the swallowing of the aspirin was the third group. So if you feel like you're having a heart attack, call 911, chew an aspirin, try to be as comfortable as you can, because you might be having trouble breathing, might mean to loosen some clothes, or some people can't lie down because the stomach puts pressure on the abdomen, on the diaphragm, excuse me, and they can't breathe as well. You might have to sit up, try to be comfortable, and unlock the door so
Yeah.
your paramedics can get in.
Yeah,
So,
absolutely.
yeah.
Absolutely. So those are great signs and symptoms to share and to let others know, for women to be able to share with women, and for even women to, educate the men about this, because you were in the nursing industry and you're in there and it's like, hey, this can't be a heart attack. This can't be a heart attack. So, and your suggestions to call 911 and the aspirin. So I want to transition to another question, because this is something that I encounter as a grief coach. So talk to me a little bit about the heart and grief, and your take on something that isn't always recognized in the medical realm, but something called the broken heart syndrome.
Yes, they are starting to recognize that now in the medical field. The broken heart syndrome. Well, anytime that you're under stress, you release those hormones that make your heart beat faster and harder, and your blood vessels constrict. And then your heart has a harder time of pushing the blood around. So, minimally, it could cause what we call angina, which is where there's an obstruction in the blood vessels, but it's not a complete blockage. But there are some instances where it has caused complete blockage in the heart. So it is definitely something to be reckoned with. So when you're experiencing something like that, give yourself some slack. I always say slack. It's our grace. And be good to yourself. And well, you're the expert at all that, what to do, but it is a definite thing to consider, particularly if people have other risk factors that we've discussed, the blood pressure, diabetes, things like that, smoking in particular. Yes. So it definitely is something. So don't think that that's just crazy, because it's not. It is definitely a thing, the broken heart syndrome, where people have actually had heart attacks from grief.
Yeah, absolutely. Well, Martha, this has been some amazing information. And so what I would like to ask you is, so if somebody's gone, you know what, Martha's got some great information, how do I get in touch with you?
Okay.
So if you would share with us ways that they get in touch, or do you have any special, offers that you do? Talk to us a little bit about that.
Sure. Okay. Well, I do have the Facebook page, and as I said, I share information every week on a different topic, and you can ask me questions too through the Facebook page. And that Facebook page is called the Healthy Living Adventure, but it is under Martha Kieffer RN. And yeah, or you can
your last name. That's K-E-I. Do I have that right?
K-I-E. It's
K-I-E. See?
I before E and two F's. That's me. I before E and two F's. That's me.
Okay,
so
perfect.
Kieffer. But you can always email me at martha@healthylivingadventure.com too. That's probably an easier way, easier thing to remember. Healthy Living Adventure, Martha@healthylivingadventure. And I am offering the free risk discovery session. And in fact, if you do, this is Heart Month, so I'm offering a special. If you do the discovery session with me this month, I have a whole blood pressure chart where you can keep track your record of the blood pressure, and then it's got the chart to see where your blood pressure falls. If you've got high blood pressure or elevated or whatever they're calling it, to see where your blood pressure falls, and then some suggestions on how to take a good blood pressure, because so many times we're not getting accurate readings. So it has all that. If you do a discovery session with me this month, I will send you that tracker. And then I do have a 4-week course on diet, exercise, heart disease, that kind of thing. So I have that available. And then also that I do one-on-one counseling too, if you want to do that. So
awesome.
Yeah.
Awesome. Well, it sounds like you are so passionate about what you do and that you're investing in helping and changing people. And it's not just that person. As we know, the consequences when somebody makes those choices, life decisions, not to change, and those that are left in their tracks. So I am so grateful for spending our time together. Thank you, Martha, for joining us. Is there any last piece that you want to add, or shall we just direct everybody to go set up that discovery session with you and find out from somebody who's seen it, done it, and knows what it's like?
Yeah. Just remember that when it comes to healthcare, you are the most important person in your healthcare team. So make those changes, take control, take responsibility. Yes. Thank you for having me. I really enjoyed it, Peggy.
Yeah, thank you so much. I appreciate it, Martha. We'll talk soon.
Okay.